Harry was a patient of mine for about 15 years. Then Harry suddenly disappeared, only to reappear in our emergency room desperately ill in congestive heart failure. I learned shortly thereafter that Harry had had open heart surgery about 3 months earlier at a city about 30 miles away. Unfortunately, Harry's condition further deteriorated and he died about 3 or 4 months later. On one of the last visits, just before Harry did pass, he and his wife acquainted me with the fact that they were rather upset that they had had to leave my care several years ago. And what had happened is Harry's employer had found a new insurance company to take care of their health care needs, and that company forced him to go to a city 30 miles away where he had to have a different physician taking care of both his family doctor needs as well as his cardiology needs. Harry's health care, I think, was compromised by him having to make that move. He said that it was a hardship for him to get back and forth because his wife had never driven and Harry's own health was such that he could not often drive, and therefore they were dependent upon friends and family to get them back and forth. And so it was a hardship for them. They really didn't feel that the system had treated them very well. Now here's the real irony. The private insurance industry would have you believe that we single-payer advocates are limiting choices, when in reality it's the private insurance industry that limits your choices. But you know, as the old adage goes, if you tell the lie often enough and frequently enough, eventually people will believe it. In reality, Harry's life was probably shortened and certainly made more complicated and more difficult than it needed to be because of the choices that were limited by him by the private insurance industry. Ironically, in the single-payer system in Canada, you have the right to go to any physician or any facility you wish to go to. Same is true of our traditional Medicare here in America. And yet, the private insurance industry would say that, hey, it's the public system that limits you. That's a lie. And they need to be called out about that lie because in reality, single-payer, publicly financed, privately delivered system is the one that truly gives you choices.